Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5. I'm your host, Dr. Stephanie Dueger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, to more surprising topics around the psychology and development of babies from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Welcome back to Prepared for Parenthood. I'm so excited today to have Rebecca Molitor. She's a licensed clinical professional counselor who considers herself fortunate to do what she is most passionate about, partnering with individuals and families. Her career started with family preservation programs before starting compassionate growth counseling in 2000. With over 25 years of experience as a counselor in infant mental health, early intervention, attachment, trauma, and mindfulness, Rebecca frequently provides training and consulting services within Illinois, nationally and internationally. More recently, Rebecca is a certified prenatal bonding BA facilitator and trainer, which we'll be talking about today. And she also explores the world of writing haiku. So welcome, Rebecca. So happy to have you here today.
Thanks for having me.
Yeah. So I'm wondering if you could share with our audience just a little bit about your journey into becoming a prenatal bonding BA facilitator and what prenatal bonding BA actually is.
Sure. My practice has always been on attachment and trauma, and I started that journey really early on in trying to help families remain intact through child and family services. And so then my world kind of exploded when I started thinking more about maybe if we could increase their connection, we would decrease the disruption in families. So that work continued for quite some time. One of my mentors is Michael Trout, and he actually introduced me to prenatal bonding BA and asked me if I was interested in attending a workshop one weekend. That was 2010. I probably had no idea that I would be here 14 years later where we are. I participated in the facilitation training, which has been really interesting for me and just really enhanced my work in a really different way, even when I work with people individually as a therapist and as a consultant. So I've just loved that kind of an input of extra level of juice, I think, into the work and understanding. And I use it most often in my office. Like I see a lot of families and I see a lot of women. And because I've been around for a bit, the kids that I saw are now adults having children. Like that happens when you've been in the area for so long. And so several of those kids have been pregnant and now adults. And so I've used prenatal bonding with many of my clients when they are open to it and they're wanting it. That's had a different interest about it, but the role of when people have underlying issues that they've struggled with most of their life, even like of depression or anxiety and trauma issues and family dynamic issues, what happens then when you're pregnant? And what does that mean when you start your own family? My real focus and hope for this work is we really think about what could we mitigate for the future generations and what could that mean? And now I'm a facilitator and a trainer, and that's more new stuff. But what is prenatal bonding BA? It's a really good question. And I'm always like, how exactly do you describe this? Because there's lots of terms out there. And I think that whenever we think about prenatal bonding, and there's many people that the term is a very generalized term. And all of it is good. And I really think that's an important part for parents and pregnant people to really sit in on, that you don't have to have the perfect approach. But when you take that time and the method that speaks to you, that's the most helpful thing to do, right? And for some, it's music, and for some, it's other strategies. Prenatal bonding BA specifically was created by Jenoe Raffai and Dr. Hidas in Hungary in the 90s, and then was trained by Gerhard and Schroth, and they were the ones that trained us. So it's new to the United States, but not necessarily new to Europe. Certainly not new to Germany. That basically takes time for the mom and the dad and the parents to be with their unborn child. We start at about 18 to 24 weeks. And it's really about creating a space of holding parents in a way that they can let the rest of the world go for a while, really sit in on their pregnancy, what it feels like for them, process through some things that may come up during the course of pregnancy. And then near the final stages, really think about how do we separate in a healthy way for the end of the pregnancy, but also for the mom and for the baby to enter this new world, which is the world that all of us live in, at least those of us that are listening right now. So it is really interesting because the thing that has struck me about the work is the facilitator, like myself, we're not the experts in the room. We simply are there holding the space. I say simply, but it's probably complexly simple. But we are not the ones talking to the baby or guiding the baby. It's really about empowering the mother and the father to restate their own inner knowledge that they have that first connection and that they can trust themselves. And what are they hearing? We have become so medicalized in a way that's been really helpful for many pregnancies. But also sometimes I think in my experience working with women diminishes their own self-confidence in their own pregnancy. And I feel like this is another way that we can build that self-confidence. And interesting that I also hear like sometimes the babies have things to say, which is really an interesting idea. I'm in my mid 50s. And sometimes even now, I'll just have a feeling and I'll be like, I need to check in on my son and see what's going on with him. And I'd liken it to that same experience that we have an intuition that we can hone into. And maybe that intuition is actually communication in a way.
What are some of the things that a baby might say to a parent?
Yeah,
Utero.
good question. I'll just say what I've been told from moms in the process. Usually things will come up in images or words, sometimes in colors. I've had a particular person who only saw colors their entire prenatal bonding session, and it was a color that they didn't particularly care for. So things might happen like in one session, I had a mother who was trying to explain a really complicated situation she was going through. And she was really worried about how that would impact her unborn child. And then she paused as we were in the session and she said, I just see the word love. And then she started to get overwhelmed. And she's like, I think he's just telling me that he knows that he's loved and he knows that I care about him. I'm doing the best that I can. One time I had a really interesting situation where the father wasn't involved and the mom was really struggling, like not sure what to do. When those situations happen, there could be a lot of ill feelings. And she wasn't sure she wanted to give the baby the father's last name. And so I just said, well, maybe we should ask the baby in the session, see what happens. And so the mom went into our relaxation session and she sat for a while and she just started to laugh in the session. And she said, he says he wants his name. And so that's the thing that I find so interesting, that women sometimes will get feelings, they'll have words or images or colors. But the part that helps me to understand the differentiation from their own experience is that oftentimes it's different than what their ideas are. And then they'll suddenly go, okay, I guess that's their idea. And I really trust the mothers in that process. I believe that they know more about this baby than I certainly do.
Amazing that our unborn babies can speak to us in some way and communicate with us in some way when we're really tuned in intuitively. What are some of the things that parents might say to their unborn baby?
I think when you were just talking, Stephanie, about how it's amazing what babies might say, I think in a way, when any of us go into a deeper relaxation or any of us have done meditation and kind of allowed ourselves to let the rest of the world go by and not overpower us, we start to notice things about our own bodies. And I think it's important to always remember that when a baby is in utero, they are literally connected, right? We have to remember that they are connected with through the umbilical cord. So they are one in those times. And I think that's another reason why mothers have that ability to have that communication, is because they're really honing into another part of them at that time. I worked with several mothers who have struggled with pregnancies, and that was really difficult. And so sometimes they want to tell them the story of what happened. Sometimes they want to say, I'm sorry that I had those feelings early on, that I wasn't sure about this. And I worked with several women during the COVID during the pandemic, where we started off in person and then we had to switch to Zoom because of the shutdown. And many of the sessions were about just helping them understand what happened, like why suddenly mom wasn't at work anymore. And then while your brothers and sisters are around you, and I'm really stressed, and like you can't hear everybody, and all these things. So sometimes it's about everyday life. Other times it's about what their father or their other parent is like. I've worked with some families that used in vitro. Someone who had used a donor egg that had her used their husband's sperm, and the wife carried the pregnancy. So part of the sessions were explaining this is how you were conceived. And so in a way, it's even interjecting some of the narrative therapy approaches from the very beginning. And I think that also helps the parents. It helps the parents say, it's okay to have this narration throughout their life. Let's just start now. We don't have to wait a certain magical age to share. This can be their story. And I find that really enchanting about it. It's a way of really honing in on the value of family connection. And there's no perfect age to share the big news of anything. Let's just talk about it all along. Really, that causes way less difficulties in family dynamics.
And just to piggyback off that, is there a reason why you don't start prenatal bonding BA until about 18 to 24 weeks?
The most significant part is that tends to be when mothers tend to feel and notice their baby more. The other thing that I think is really interesting, and this is just anecdotal information, this is nothing that we have research on, is that in utero between 18 and 24 weeks is when a part of the brain is starting to develop, the medial prefrontal cortex. And when that part of the brain is developed is when we are literally starting the time of weekly sessions for mom to relax, to connect, to be held, to take care of herself. And so what I find interesting, and I'm not sure if Hidas and Raffai knew this and thought of this, they might have, I don't know, is that we're noticing that the kids, when they're kids later, these are children that are much more curious, much more empathetic, have developed a great deal of social emotional adaptation and abilities. And so I really wonder about that part too. So I know that it's a way that mothers certainly start noticing and feeling connected to their pregnancy at a greater time during that time frame. But I also think the results are related to when the fetal development really happens as well, and what that impact is long term for the children.
Can you speak a little bit more about the research that has been done and the information that has been gathered through that research?
Yeah, sure. So on prenatal bonding BA, right now we have one research article that has been published, and that's been through Anna and Gerhard and Raylene Phillips, a neonatologist out of California. And in that article, the research is from 2017 to 2020 with European mothers. It's a small study, about 300 women. But what they've noticed is significant reductions in a few areas, significant reductions in postpartum depression compared to the norm. So the norm for postpartum depression is about 15 to 30% sometimes. And what we're seeing with people who participate in prenatal bonding BA is it's as low as less than 1%. We have baby blues that are, again, significantly reduced to less than 2%. We have infant colic, which I think, as a person who has spent their career focusing on attachment and trauma, colic and postnatal depression is a really important thing to focus on, because that's what disrupts the attachment after birth many times, just by the nature of what each individual person is struggling with. And so with infant colic, we've noticed the results are significantly less than 3% of kiddos who participate in prenatal bonding VA have infant colic. So we're really seeing some startling effects. And then we're noticing some increases in breastfeeding. So women who have participated or tend to breastfeed longer at a significant rate, which of course then people could say a lot about how that builds that maternal bond and child bond. So I really think that could be the catch when we talk about parenting. If we can resolve some things before birth to give the space for a mom and a dad, or two moms and two dads, and all the different configurations that can happen, let's openly work through that ahead of time, and then make the birth process less angst filled, and then make the attachment process afterwards even more enriching. So that's my hope as I think about the results so far that we've seen. that are published, I primarily work with people that have had prior mental health issues. And the one thing that I've noticed, which has really been interesting, is that none of my moms have had postpartum depression, even though I have women that have been on medication for most of their lives for depression and anxiety. Now, they've also continued to participate in therapy afterwards. So it's not like this is the only thing that they did. I don't want this to seem as if this is the one thing that helped, because I think they were really wise in creating a toolbox of resources around them. And that's what I think this really is. I think it's another tool for parents to consider when they want to have a deeper connection, or they know something might be happening that might be derailed early after birth.
What is the number of weeks that someone would participate in prenatal bonding being? I guess
So
does
usually
it start at 18 weeks and go all the way through the end?
close to the end. So it starts at anywhere between 18 to 24 weeks. The first part is doing an intense history. And oftentimes people find that really invaluable to kind of uncover and notice the healing that's happened throughout their lifetime. Then there's anywhere between 10 to 12, what we call baby sessions. And those are the individual times. And then the very end, which ends at 36 weeks. We start at 34, we end at 36 weeks, is the time frame of preparing for separation, preparing for birth in a very intentional, scripted way, where we talk about what to expect for the mom and for the child yet to be born.
And has research been done? You mentioned two dads and a baby.
Yeah.
Or, any couple who is not able to biologically have a child. Has research been done on sessions being done with couples with a pregnant carrier or bio mom? What does that look like?
Well, there hasn't been research that I'm aware of that's been published about that. I've worked with multiple families that have used IVF and donor sperm or donor eggs. And I've worked with families that one partner was going through a gender transition during the course of the pregnancy as well. And I've worked with families that are same sex. And I haven't seen significant differences. In fact, what I have found is that it appears as if it's helpful for families at the very beginning to feel like they're a family from the very beginning, to feel that included in the whole process. And it's just a beautiful time for every person to say, we have a role in this.
I know the research is still in its infancy,
Very much.
but what do you imagine is creating such dramatic changes postpartum? So decrease in postpartum depression, decrease in colic, increase in children's empathy and things like that. What do you imagine is the impetus behind that?
Well, I probably have a biased opinion because my focus is always on attachment. And so I do believe that when we as human beings feel held and connected, that we heal and grow. And I think most people in our world probably agree with that. So I think one of the significant changes that happens is that women who are pregnant, when we talk about postpartum depression, they're not alone. They literally have the same person that they trust to hold the space for them week after week. It's not someone examining their body. It's not someone saying, what are you doing? It's someone just saying, I'm here for you. And I'm going to be here for you so you can be there for your baby. And what are you noticing? So I think there's an element of that we just miss probably in our entire culture in a way. So I think that is incredibly helpful. I think they also get to gently uncover and resolve some things that might later go unnoticed or untalked about regarding postpartum depression and some derailments in attachment connections later. For the children, I think the same dynamic, that I think that they are already feeling connected and attached. They're already prepared for birth. We talk implicitly about what to expect, who will be there, how will it be, and not just the words, but even sending images to the baby. Like one session was for the mom to really think about sending an image to the child before birth about what it's going to be like, what they're going to notice in their own body, right? As the birth process happens and it gets really like tight and they like, this isn't how it's been the last 9 months. This is a sudden change. And then, then what to expect next. And the other part that I know we have no research on, and we may never have research on, but I just really have a hunch about this. I imagine that when we take the time, especially in our very busy, involved culture, to help the moms reduce their stress, to reduce their cortisol, to reduce their whole autonomic system, just to help them stay in a calm space and be supported, then that is transmitted to their unborn child. At the very time that the part of the brain that regulates emotions, the amygdala and the prefrontal cortex, the very time that that's being developed. So I have a hunch that there's a connection there, because we know that interaction and attachment builds neural paths. We know that that happens. So I feel like we're getting a head start in a way.
And in between sessions with a facilitator, are parents practicing things? So it's not just, say, once a week with them.
Yeah, exactly. Yeah. So there's a few things that we always recommend, things that are really common. Of course, for the father to be involved or the other partner to be involved and read a story every night, and even having some physical touch. One mom, actually, I just did her 6-month evaluation a few weeks ago. She had gone through a great deal of stress during her pregnancy. She had had a miscarriage a year before. That was really problematic for her. She was very scared going into the second pregnancy, and then lost her job while she was pregnant. So there's a lot of stress. And when I did the evaluation with her last month, one of the things she said is that the sessions allowed her to remember to let go of all of that. Right. We did the sessions by Zoom where she was in her own home and she was able to be relaxed. And that really then allowed her every day just to go back into like, let me just relax and let go, just like I did in sessions. And so she just increased her awareness of that. And again, she had other supports too, right? She had a very supportive family and she therapy. So it's not like this was the only thing she did. But that was her comment, that she really felt like prenatal bonding being really helped her to say, let me protect me and the baby from the rest of the world and all the things that happen.
And along those same lines, sometimes we don't have control over some of the things that happen, particularly around birth and post-birth. And I would say maybe especially in this country right now, we have very high rates of cesarean births and things like that. Does a baby ever say, hey, I can kind of see ahead to what's going to happen, and I'm not going to come out vaginally? And a second question to that, is there a resource that you give to parents if they end up in a situation that is unexpected during birth or post-birth, where they can still stay really connected to their baby, say during a major surgery like a cesarean, or something happens where the baby needs to be whisked away and perhaps resuscitated? Is there anything around that with prenatal bonding BA?
And thanks, Stephanie. I don't have a personal experience of having a baby say, I'm not so sure this is the right way for me to be born. I don't have that experience. We do prepare moms for a vaginal birth as well as a potential cesarean, especially if that's something that's been talked about. Quick story about one woman who had very traumatic births for her first 2 children, who both had developmental and one has a genetic disorder. And so she was pregnant again for the third time, late in her 40s. So there's a lot of risk factors. She was very worried. So when we did our sessions, one of the things she did is she said, I want to prepare you. My body's history is that I tend to have a really challenging way of giving birth to babies. So you might have to come out by cesarean section. But this mom really wanted a VBAC. She really wanted a vaginal birth. So we prepared for both ways. This is what will happen. And I'll be with you this entire time. And that's the most important message through the separation, is that, yes, we are separating. And yes, you will be entering literally a new world, but I'm still with you. I'm with you through this entire journey. And I want you to trust in that. Like, I know a little bit more about this new world, and I'm going to try and put everything in place to make sure you're as safe and cared for as you can be. And this particular woman that I mentioned, she was able to do a vaginal birth, and it was very fast and it was unproblematic. And it was what she also wanted. This kiddo who's now like 7th grade, I think, he talks about that. He's typically developing, and he knows he was involved in prenatal bonding because we've talked about it in our time together. And he was like, yeah, I know I was going to be okay because he has a 7th grade perspective, right? But it's really charming to me to think about, like, when kids who are older come back to my office and they think about, I was here before I was born and we did this. And so I think that's an interesting dynamic that happens. But there was another family that I worked with, and it was actually one of my first families, who came to me because they knew in utero that their child had a congenital birth defect. And the mom was a very astute individual, and she was very concerned about the separation of the attachment right after birth. So we did prenatal bonding sessions, and much of it, especially near the end, was the preparation of what had to happen for his body to be sustained. Because when this little guy was going to be born, prenatal bonding cannot fix a heart that is developed inappropriately. And it's not trying to say that. But the point for the mom was, how do I help make this transition and everything as understandable as possible? And so we spent an enormous amount of gentle, slow time saying, this is the plan. This is what will happen. You'll have to leave me in this hospital. This is who will touch you. And this is who will be there and what the surgery will be like. And I've had the pleasure of working with this family even today still. And he's about 12 now, I guess. And amazingly enough, yeah, he still has a heart issue and he's gone through 3 surgeries. Even after birth, while he had early intervention services for developmental therapy and physical therapy and occupational therapy, things that we expected, he never showed a delay in social emotional development. In spite of being in the NICU, in spite of having 2 major surgeries under the age of 1, and then another at 2. So in spite of all these things, emotionally, he still continued to thrive. And even now, he has a great emotional IQ. He's very attuned to the world around him in a really interesting way. So I think that is another part. Like, there are some things we can't help when we have babies that we know in utero have medical issues. But there are some things that maybe we can do to help them, and even to help the parent really process, how can I still be there as best I can?
So, Rebecca, do you know anybody who has checked in with their young child, probably under the age of 3? I was speaking with Dr. Thomas Verney about how babies can remember their births. And often the best time to check in with them about this is between about 2 and 3. Has any parent and their young child come back to you where the child has remembered doing these prenatal bonding BA sessions and can share about their birth or share how they felt it might have impacted them? I know it's very young, but
Yeah.
I was always surprised when my children could share with me things that I didn't expect that they would be able to.
No, it's an interesting question. So I've had kids who've come back to my office where I do the sessions, and their moms have said things like, and there's 2 little kiddos that I'm picking up right now. Their moms have said, do you remember you were here before you were born? And their response was, yeah, I know. And they will immediately go to parts of the room without hesitation, which is kind of an interesting dynamic for me as a mental health therapist, because between 2 and 3, generally when kids for the very first time come into my office, they don't feel comfortable to freely explore. Usually they need a little bit of warm up time. But these 2 kiddos, they immediately went to like different parts of the room with great ease and comfort. And so I was like, that's interesting. Like, is there a part of them that felt this presence and knew this? And certainly there are a number of times when I've done the follow-up interview and babies have interacted with me, even as I talk to the parents, and the moms will reflect back, I think they remember your voice because they're responding differently than what they have with other people when they've talked to other people. But you're making me wonder, and Dr. Verney would that be a cool thing to do? Is to ask some of these kiddos between 2 and 3, like, what do they remember about their birth? That would be a great question to ask.
So fascinating.
Yeah. Yeah.
So you said the prenatal bonding BA has traditionally been a more European experience.
Most facilitators are European that have been trained.
Yeah. Do you know how many people in North America are certified to do this, and how many people worldwide might be certified to do this work?
I don't know the exact number for worldwide. So in America, we have about 20 people that have been certified as facilitators. And if you go on my website under Prenatal Bonding BA, there's a link if you're looking for a facilitator, and people can click on that and there's a listing of the facilitators and where they're located. Worldwide, though, I think it's many more because in Europe, there was quite a few people in Germany, and there's people in Switzerland as well as Austria, and Hungary too. Now, you're making me think about the babies part. Like, how many babies in America? I can tell you my first baby. I have a family that I've known for a long time. And when I see them, I say, you were the first prenatal bonding baby in the Midwest. But I think it's growing as we get more facilitators. And this method is more involved than a lot of the other approaches. And so I totally understand that. And it's more involved than what some people and families feel like they can do at the time. Pregnancy dialogues is a short version of a group method, which I think is a great idea. And it might be a great fit for some families too. I just really hope that more and more people take the time before birth to take care of themselves in that preparation phase, as well as to take care of their pregnancy, their unborn child, and then thinking about birth. I think we rush through it so much, especially in America, as if it's another thing we have to do as compared to what we are experiencing for 9 months or so.
And are there groups where you facilitate a group of prenatal bonding VA pregnant parents, or is it more just one-on-one?
It's more one-on-one. Yeah, it's not meant to do it in a group setting. We haven't done that as of yet because it's so personal and there's such strong histories that are discussed that sometimes they haven't even shared their partners, which is another dynamic. We want to make sure we hold that space and keep that very secure and safe for everybody.
And who gets certified? So is it just therapists, or are there other professionals who work with pregnant families?
That was the thing I thought that Raffai did so brilliantly. Like, it was part of his goal that this is a method that could be used by therapists, psychoanalysts, but also doulas and birth educators and midwives. So in the facilitator list, it's pretty diverse. We have therapists, we have doulas, we have midwives, we have craniosacral specialists that are also trained in it. And so it can come from a number of different backgrounds. But the combined background is just an intentional awareness of the value of this time frame, but also the willingness for a facilitator. You have to kind of look at your own storyline, which can be a little daunting for anybody to look at their own life and wonder about that and what that was like. And that sometimes takes a little extra work, and that's something that everybody maybe will choose to do.
So how can people get in touch with you and find out more about prenatal bonding VA?
The easiest way would be to go to my website, compassionategrowth.com. We have 2 training cohorts that are being developed for people interested in being a facilitator. One will be based in Europe only, and the other will be here in the United States, and then one stop in Europe. It'll be a combined Zoom and in-person sessions, and that'll be starting this June. We're really starting in September. June is going to be like a soft start. So if anyone's interested, please reach out, and I'm happy to talk further with folks about that.
Thank you so much for being here today, Rebecca. It's really nice to speak with you.
Thanks, Stephanie, for having me. Appreciate it.
Take care. Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.